to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Hi day and welcome back to Healthy Living. Before we wrap up our show, let's take a look at some of your questions. All right, Doc.
Sure.
One of our viewers asks, how can you tell if it's more than just carpal tunnel?
That's a good question too, because numbness and tingling in the hand can originate from a couple of other sources. Sometimes people will have a pinched nerve here at the elbow, their ulnar nerve, or it can actually be coming from their spine, from their neck. So if they've had a neck injury, if they have neck pain, these are the things that we ask when somebody comes in with those symptoms in their hands, especially weakness of the hands, because the problem can be higher up. And that can be actually tested out with a couple of tests. We can do an MRI of the neck to see, and we can also do what's called an EMG. And these are tests that check the strength, the electrical activity of muscles. They're tiny little needles that are placed in the muscle in different muscle groups, and we can see how well they're functioning. So you can tell whether it's a peripheral nerve problem, meaning a problem down here, or a problem up higher.
Okay. Now, sometimes having carpal tunnel also requires surgery.
It does.
So can you share with us at what point, does that actually occur?
So here's the steps. Somebody comes in with carpal tunnel syndrome. We do a few evaluations. You can tell that the person's probably got a pinched nerve here in their wrist. So we tell them to ice, wear the brace, and try Motrin or another anti-inflammatory if they can take that for about 6 weeks, and in a good dose. So like for a regular adult, maybe 800 milligrams 3 times a day for a 6-week period of time. Long, okay, long and slow. You're not taking it for pain, you're taking it for swelling to try to shrink it down, and also ice and wearing the brace. And after 6 weeks, if there's no improvement, we'll put a steroid injection right here in the wrist. That's not terribly painful, just a tiny little pinprick to just give anti-inflammatory right here into the wrist. And then wait another month or so, see if it settles down. And if it's not getting better, the next step is to go and see the hand surgeon, which we do have Dr. Landstrom here on island. And what he would do is do a little surgery where he releases the carpal tunnel, meaning that he just basically makes a small incision to cut through the tissue that's holding everything tight to allow the nerve to be free. So then the question is, well, is that permanent? Answer is, it'll be pretty good for a long period of time, as long as your activities, right, are not the same as they were before, because that's what caused it in the first place. Because sometimes there can be scar tissue that occurs from the surgery, and then the problem recurs because of your activities.
Oh, okay. Now, can carpal tunnel be reversed, so that you don't have to go through surgery?
Yes, sure. Let's say you're obese and you lose weight. Let's say you're pregnant and you have the baby, or the thyroid gets fixed, or whatever things you were doing at work, you were using your hands too much and you've iced and you've taken your Motrin and it's all better because you changed jobs. Sure. So it can get better all by itself with some attention, and those not everybody needs surgery, is what I'm trying to say.
All right.
Yeah.
Now, sometimes you can see individuals with, like their fingers are stuck in a certain way. Now, is that a result of carpal tunnel?
Not usually. Carpal tunnel, if it's severe and it's not treated, the pain is really horrible because it is a pinched nerve, terrible agonizing pain. And there'll be weakness here in the thumb usually, and there'll be flattening of this thumb area here. But there won't be usually a restriction in the movement of the fingers. When you see that, that's more likely either trauma or severe arthritis, like especially rheumatoid arthritis, where people actually have crippled fingers, or some other injury that they've had to their system.
All right. Now, can carpal tunnel lead into something severe like rheumatoid arthritis?
No, they're entirely separate. However, people that have rheumatoid arthritis have tons of swelling in their hands, and they can get carpal tunnel syndrome. So it's kind of the other way. If you have arthritis that's severe, your bones can be, the area can be very inflamed, and you can develop carpal tunnel syndrome, yet another problem on top of what you already have.
Okay, now we spoke a little bit about obesity and other factors that contribute to carpal tunnel. But one viewer is asking, can things such as diabetes or smoking attribute to carpal tunnel?
Definitely. Excellent question, yes. So with diabetes, of course we know that with diabetes and obesity go hand in hand. But people that are diabetic, and even let's say they're not overweight, will have a change in their circulation, and they will have more deposits of fat and other fluids, let's say, in their joints. And so, yeah, they're more prone to carpal tunnel syndrome. As far as smoking, definitely smokers don't heal as well from anything, and they are more likely to also have carpal tunnel. And both those groups, the smokers and the diabetics, heal poorly or not as well when they have surgery. So if you're going to have surgery, please quit smoking and control your diabetes. And they have a higher chance of recurrence. Both of them do.
All right, thank you, Doc.
You're welcome.
Again, thank you for your expertise.
Thank you.
We'll be back again to